So I'm going to step back a bit from the presentations of work from React and just tell you very briefly and generally a few things that I think we know and some that we don't know from the research that's relevant to thinking about implementing React. So these are the 4 questions that I'm going to briefly tell you what I think we know at the moment from research, particularly research about supporting people with psychosis, but a bit about research in health more generally. So first of all, is supporting self-management generally important? Well, Alison's already told you that it's a major policy priority, and I think that's quite right when you look at the research across the health board. So it seems that helping people develop their strategies for managing and coping with their own conditions is important across many physical and mental health conditions. In mental health, that generally includes psychoeducation, relapse prevention, crisis planning, working towards recovery. And if you look at conditions like diabetes, asthma, all sorts of health conditions, there's evidence for the helpfulness of self-management. The evidence is that it's particularly helpful when it's supported self-management. So not about people being left to their own devices to help save the health service money, but about people being supported in coping with their health problems with the support of those around them, including professionals, sometimes including peer supporters, and very importantly, including their family and friends. And so that's, if you want to read up about this, this is a big scoping review that was published 3 or 4 years ago by a team looking at the health literature generally and finding that there is really good evidence for the benefits of self-management, often including carers in the sort of supporting self-management team, and that those benefits are across a range of long-term health conditions, physical and mental. And the other paper I just point you to, if you want to look at this further, is a paper that my colleagues and I published a couple of months ago, looking for the evidence for supported self-management for people with significant mental health problems. So for people who use mental health services, and again it looks pretty positive with good outcomes that range from improvements in symptoms to more kind of subjectively important outcomes like hope, like people's assessment of their own recovery. So good evidence that all this is important. What about if you look at family and friends? As I said, already quite a few of the bigger packages I've talked about will include family and friends to some extent. In mental health, what there's really good evidence for is a range of psychoeducational approaches for carers. Actually, the benefits that have been shown are most of all for service users. So in areas like relapse and the well-being of service users, that's where there's most clear evidence for benefit. So it's interesting thinking about React, that it may well have had significant benefits for service users, which because of its sort of distinctive form, that it's just carer focused, it's not actually possible to measure. But there is a reasonable consensus that it's also important for carer well-being. That's quite often not being measured. Quite often the major outcomes in the literature are to do with service users. But as far as we know, it's helpful to carers. However, the point that's already been made is that there are big implementation problems. And really for the last 40 years, 50 years, we've known that supporting carers in how they cope with, how they support their relatives who have psychosis is really important, if nothing else, to the outcomes of people with psychosis. And yet we're still in this situation where well under 10%, as Alison has said, of the people who would benefit from that approach actually get it. And that's, I think, where the REACT intervention is distinctive and has considerable potential, as was shown in the early trial that Fiona did of 100 or so people using a paper version of REACT. The power of REACT is that you can go straight to the carers, and therefore you get over some of the implementation problems that are involved where service users have to be on board as well. Okay, so I've only got 2 minutes. So how widely used are digital tools in the NHS? Well, REACT is doing pretty well comparatively because, again, over many years there have been serial failures to implement digital. In 2016, the King's Fund reported that despite many attempts to implement digital tools, fewer than 2% of service users across the NHS said they'd had any kind of care provided by digital means. On the whole, more tends to work in primary care than in secondary care, but still widespread non-adoption, and that seems to be the case actually in quite a lot of other countries as well. So what are the main barriers, finally? Why do things not get adopted? Well, I think there's some learning from REACT, but there is some evidence developing about non-adoption and why it is. The REACT team did a review led by Golnar Arif, and that found that major barriers were scepticism among staff, service users and carers, which was common, lack of digital skills, and above all, lack of staff support and time. If you want to read one piece of work in this area, I'd recommend this recent paper by Trish Greenhalgh, which is a new framework for looking at non-adoption and abandonment of new technologies. And she suggests that what tends to happen, the kinds of technologies that get abandoned, are above all the ones that she describes as complex. And complex technologies are ones where you need some sort of significant changes in systems and staff practices to take them on board. They're ones which are hard to set up. They're ones that don't have clear funding bases and clear ways of fitting in. And she suggests that by applying this set of ideas about what's complex, you can actually explain many of the digital failings of the NHS and other health systems. So that's her framework, which I'd recommend looking at. Okay, and some final thoughts about what all this means for REACT for you to look at. Okay, thank you.